Hey everyone. We often talk about compassion, but what does it really look like when it's put into action? Like a real concrete plan. Today, we're going to dive into exactly that. We're looking at an amazing organization called the ATG HealthCare Foundation and how they're taking on one of India's toughest challenges, making healthcare accessible for everyone. It's about building a movement, and it's a story you'll want to hear.
So, let's just get real for a second. In India, a medical emergency, it isn't just a health crisis. It's a financial catastrophe waiting to happen. I mean, think about it. It can literally wipe out a family's life savings overnight. And this is the harsh reality. These incredibly high out-of-pocket costs are pushing millions of people into poverty. They're forced to make an impossible choice, between getting the care they desperately need and, financial ruin. It's a heartbreaking situation.
So it really makes you wonder, right? When the system is stretched this thin, who steps up? Who's going to fill that gap for the communities that need it most? Who's really on the front lines?
Well, that's exactly what we're talking about today. The answer, or at least a big part of it, is the ATG HealthCare Foundation. These guys are stepping right into that gap, becoming this powerful force for change exactly where it's needed the most.
And what's honestly kind of mind-blowing is how fast they've moved. Just look at this timeline. They were founded by Dr. Vishwasrao Gary in October 2023. That's really recent. And already, they're operating in Mumbai, Hyderabad, and Jaipur. To go from an idea to a multi-city operation in such a short time, that's not just impressive growth. It tells you everything you need to know about how urgent and focused their mission is.
Okay, so what are they officially? ATG is what's called a Section 8 company. Now that might sound a bit technical, but all it really means is they're a registered not-for-profit. And this is the crucial part, you guys. Their goal isn't making money. Their bottom line is impact. Every single penny, every resource gets reinvested right back into their mission. No shareholders, no profits, just purpose.
Okay, so if it's not about profit, what is it about? Well, their entire operation is built on a really clear 5-point mission. You can think of these as the strategic pillars that hold everything up. Every single thing they do is defined by these 5 goals. Let's take a look at what they are.
All right, here we go. Cancer prevention, HIV/AIDS prevention, women empowerment, child welfare, and education and skill development. You can see it right away, can't you? These aren't just separate boxes. They're all connected. It's not just about fighting diseases. They're going deeper, focusing on the actual building blocks of a healthy society. It's a whole picture approach. So let's dig into what each of these really means on the ground.
First up, cancer prevention. And their whole strategy here is being proactive. They're not just waiting around for people to get sick, no way. They're all about raising awareness and pushing for early screening, because we all know that's the game changer, right? Catching it early can literally save lives. And they don't just stop at the clinic door. They stick with patients and their families, giving them the support they need to get through that incredibly tough journey. Next on the list is tackling HIV/AIDS. And they have this kind of two-pronged attack. First, there's prevention. That means education, getting the right information out there so people can protect themselves. But the second part is just as vital, support. For people who are living with HIV, the foundation is fighting to break down the stigma and build up the kind of support systems that make all the difference in their quality of life.
Okay, pillar number 3, women empowerment. And this is so important. They get it. They understand that you can't have a healthy community without empowered women. It's just that simple. So by giving women access to education, resources, and real opportunities, they're not just changing one person's life. They're creating this incredible ripple effect that lifts up whole families and entire communities.
Then we have Pillar 4, child welfare. I mean, this is all about the future, right? It's about protecting the next generation. By making sure kids have the love, the care, the education they absolutely deserve, the foundation is basically laying the groundwork for the future leaders and innovators of the world. And that brings us to the 5th and final pillar, education and skill development. This one really ties it all together. It's that classic idea, Give a person a fish, you feed them for a day. Teach a person a fish, you feed them for a lifetime. This isn't about short-term fixes. It's about giving people the actual tools and skills they need to build a better future for themselves on their own terms.
So, okay, that's the 5-point plan. It's a great strategy. But let's be honest, a mission statement is just words on a page until you actually do something. So the big question is, how does ATG take these big ideas and turn them into real, measurable impact on the ground?
This is where the rubber meets the road. I mean, look at this list. They're out there running free healthcare and eye care camps, often in places that are hard to reach.
They're providing financial support so people can actually afford treatment. They're offering palliative care with real compassion. They're even training everyday people in basic life support. Every single one of these activities is one of their pillars brought to life.
And here's something super smart about how they work. They don't try to do it all by themselves. They know that collaboration is everything. Just look at this table. They partner up with absolute top-tier experts and institutions. We're talking people like the famous oncologist Dr. Suresh Haramadvani. By doing this, they're able to bring world-class care and expertise directly to the people who need it. It's all about teamwork.
Let's just take a closer look at their cancer support for a second, because it's a huge piece of the puzzle. This chart breaks it down perfectly. You can see exactly where the money goes. It's not just some vague fund. It's targeted aid for the things that cost a fortune: surgery, chemo, radiation, those essential medicines. For a family that's already going through so much, this kind of help is, well, it's a lifeline. It's as simple as that.
All right, so we've covered the what they do and the how they do it. But let's pull back and look at the big picture. Let's talk about the why. What's the end game here? What is that brighter future they're fighting for? And this right here, this is it. This is their vision statement. Let's just let that sink in for a second. A world free from the shadows of illness and inequality, where every individual thrives with dignity. Wow, you see how it's bigger than just medicine? They're going after the root cause, inequality, so that every single person has a real shot at a dignified, thriving life.
And that's exactly why they call themselves a movement, not just an organization. It makes perfect sense. Their real power isn't just in their programs, it's in the people. It's this incredible community they've built of volunteers, donors, and partners who all share that same vision and are working together to make it happen.
I love this next quote from them because it just hits the nail on the head. Your donation isn't just a financial contribution. It's an offering of hope, a beacon of light, and a promise of a better tomorrow. It completely changes how you think about giving, doesn't it? It's not just about money. It's about being part of that promise. It's about being a source of hope.
Which brings us to our final question. What does it really take to turn hope into action? I think the story of the ATG Foundation gives us a pretty good roadmap. You need a clear vision, a smart mission, and a whole community of people who are committed to making it real. But that question isn't just about them. It's a question for every single one of us. What does it take for us to turn hope into action?